I went to speak at the Senator Johnson event in Washington, D.C. in December of 2022 because of my concerns about the safety or the danger of the COVID-19 vaccine for our nation's children. So I was requested to come and speak by the senator. I flew out there on personal time off from work. I've actually taught at a medical school for a number of years and also had a clinical practice. And you were there, so you saw what I said. I really honestly didn't say anything that was terribly controversial. I said there is an increase in myocarditis, which there is. I said I pulled out the package insert and showed the American public that it says intentionally blank on the package insert. And I said that we're being silenced and censored. And this is actually just proof of that silencing and censorship, what's happened to me. And I also said other nations have banned or restricted this product. And you know, again, I spoke on my own time, my own experiences, factual. And I did it because I have an obligation to speak. I'm taking care of children. They've asked us to give this product to children and to say safe and effective, and I have concerns about it. So I spoke and didn't think too much more of it, honestly, in the sense of speaking at that event. But in March of this year, I received a letter from my medical school, and it's been released now publicly, but the letter had some questions about, you know, did I take personal time to speak, and did I do it officially? And I did it the way we've always done it. My senior physicians approved it. We had substitutes for my classes. And I released a press release ahead of the event that clearly said I'm speaking only on behalf of my own views. But then the school took it a step further, and they said in the memo that they had an ethical obligation to report my words to the medical commission of my state, Washington State, because I may have spoken misinformation. And they also said in that same memo that I may no longer be suitable in teaching their medical students because they follow the evidence. And at the end of June, they failed to renew my annual contract as a faculty member. Yeah.
So it's not, they didn't tell you explicitly that this is the reason, but there seems to be some sort of correlation here. That's what you're saying.
Well, they sent a memo in March pretty much outlining all the things I had done that they were upset about, and they specifically referenced the Senator Johnson event. And again, it's my obligation to speak out. It's the obligation of any physician who thinks that there is a problem with a product to speak about that product, whether honestly, whether they're right or wrong. And in this case, everything I said was completely factual. So I'm concerned about our freedom of speech, both within the academic world of medical schools and also just for the average citizen in America who now finds themselves, you know, with a loss of their freedom of speech.
I've had numerous guests on American Thought Leaders talk about the cost benefit of these COVID genetic vaccines for children. And in particular with this disease, from what I understand, and multiple experts have reiterated this, the risk is extremely low for healthy children. I mean, if not zero, people have said statistically zero. Myocarditis is a thing with these vaccines, however rare it may be or not. And so if there's this statistically zero risk, why would you take the product? You know, that would be a normal thing for people to ask themselves, even people who aren't medical doctors or pediatricians responsible for children, right? That's what I'm thinking to myself.
Yeah, that's what I was thinking to myself too. You know, as this virus hit our nation, we were all alarmed, right? We had all this TV and media telling us how deadly this was. And of course, it was dangerous for some people in our communities, but children were spared. Children were spared from this. And if we look at the data, really it was a statistical 0% risk of your child dying from COVID, despite the fear that was being put out there about it. And we were launching a brand new product. I've spent my whole career being for traditional childhood vaccines. I trusted our regulatory agencies. I have promoted traditional childhood vaccines. And I honestly thought that all this research was being done in a way that would make sense and was there to ensure the safety of the American public. When the COVID-19 shot rolled out, we began to see issues. And I've practiced long enough that we know the ebb and flow of what normal is. Myocarditis is extraordinarily rare. We just don't see it. I saw maybe 2 or 3 cases in my whole career up until the rollout of these products. And these products rolled out under emergency use, right? We didn't have any long-term known side effects from the products because we hadn't studied them. And the short-term issues were real and they were serious. So why would we give these to a child who has really essentially a zero risk from the infection itself? It just didn't make any sense. I'm concerned that we're harming our nation's kids by giving them this, because we now have studies coming out showing that the incidence of myocarditis may very well be a lot higher than anyone realized following these shots.
Well, actually, you probably looked at this study that looked in, in a medical setting. They found that 1 in 35 had this subclinical evidence of some kind of subclinical myocarditis or harm, the trophon levels. Maybe you can just comment on that study?
Yeah, there was a recent study, I think out of Switzerland, that showed 1 in 35 people after a booster dose had elevated troponin levels. Now, troponin is an enzyme that comes from heart muscle. And so while it may not be true and full myocarditis, they didn't do further testing. They didn't do any cardiac MRI imaging or other things. Those troponin levels should not have been elevated in people after the shot was given. So there was some evidence of heart injury. What the extent of that is, we don't know yet, but 1 in 35 is just a catastrophically high number, especially when we're talking about little children who have a statistical zero risk from the infection itself, and this shot doesn't even prevent the infection, right? So what I'm most concerned about is the health of our nation's kids. That's what my job has been for my whole career. And we have every right and the obligation to speak out and to have this discussion. And instead, we have been silenced, and we have been threatened, as is evidenced by the loss of my job, apparently, over this.
What was the significance of the blank piece of paper, the vaccine insert? And why is that important?
I want to say for the record that I have actually never ordered the COVID-19 shot for a single patient, not knowingly. Because the data was clear to me as this rolled out. There were some significant issues with this. I've been watching the data. I watched the FDA hearings. I listened to Dr. Eric Rubin give a statement about how we just don't know what the long-term side effects are, so we're going to roll it out there. And by roll it out there, he essentially meant our nation's children. So I pulled the package insert out because I finally had access to a box of mRNA product, and it was around the fall of 2022. That I had access to a box of it, and I had heard people say that it was blank, but it never occurred to me that actually was true. So because I wasn't ordering it, I didn't have it anywhere available to me. But when I did get it, I opened the box, I unsealed it, and I pulled out the package insert. And a typical package insert, we find one in every single product of vaccine that we ever administer. And it's a wadded up little piece of paper that has details about what is in the vial in that box that you're about to give to the patient. And this one, I stood there with my nurse. I pulled out the package insert and I opened it right in front of her. We both opened it together. And the look on her face to see is this massive piece of paper, and it just said intentionally blank on it. And so the point of that is that what is in that vial that's in that box that someone has been asked to inject into a child?